This is an ultrasound of the scrotum of a 34 years old young boy. I have said boy because he is still unmarried, with the history of a lump he feels in the left testis, right testis. So this is the left testis, and the left testis is normal, as you can see. Its parenchymal echogenicity is normal. This is the mediastinum testis, central normal, VT testis normal, epididymis is normal. Now moving towards the right kidney, right testis. This is the right hemiscrotum. We do not see any, at least I can't see any normal testicular tissue in the right hemiscrotum. Rather, there is a mystico mass studded with calcifications, microliths. These are all tiny microliths. These echogenic particles, they are seen everywhere in all of this mass, replacing the right testis, which is not seen in the right scrotum. Rather, this mass is seen, is irregular in outline, and is mixed echo in a sense that there are hypoechoic areas, as this is done with the hypoechoic, this is hypoechoic, this is echogenic. Now this is a cystic area also within, cystic area within. So it's a mixed echo solid mass, you can see here. Mixed echo solid mass. With internal cystic areas, microliths, calcifications. Now this is the, see, the epididymis is spared almost. This is the epididymis, this one, this area. So the epididymis is spared, and the approximate size of this mass is approximately okay, I will do it again. Approximate measurement is 7.7 centimeter in length and more than 4.3 centimeter in anterior-posterior diameter. You can see cystic areas with this one, this one. These are the cystic areas. These are hypoechoic areas. Numerous, uncountable. But rather all of the mass is studded with tiny punctate calcifications. Outer surface is irregular. There is small amount of fluid seen. This one, this area is fluid in the right hemiscrotum. And see the vascularity of this mass. It is highly vascular. Significant vascularity is seen in this mass. Age 34 approximately. And the patient is not tender to the probe on this mass. No pain. Painless. replacement of the right testis with a large vascular mass of mixed echogenicity. So this is a germ cell tumor requiring further evaluation by MRI, CT, etc. to differentiate between whether it is a seminoma or non-seminoma or mixed germ cell tumor. So this is our case of today. Thank you very much.